Does any corporate hospital, owned by financiers or businessmen and managed by remote control from New Delhi or Mumbai or abroad, automatically mean a world-class quality medical care? Is it possible to offer world-class treatment outcomes at hospitals owned and operated by doctors? Is honest pricing and transparent working ever possible in private hospitals? Is it all about machines and medicines, or a human touch can be added to it? Intrigued by some of these questions, a team of doctors embarked upon an eventful journey, forming a new path with innovation and not just playing the game but changing it. A team of seasoned medical professionals spearheaded by the couple of Dr. S.P. Singh and his wife, Dr. Mrs. Kavita Sant, set out on a mission to bring international standard healthcare, which is humane, honest, accessible and inclusive. This is how Jeevan Hospital came into existence in the year 1988 in Jalalabad in the province of Punjab in India. The zeal to make a difference in patient care was an inheritance and legacy for the doctor couple. The late Sardar Jeevan Singh, a renowned inventor and freedom fighter, was an Ayurveda practitioner of undivided and new India, who strived since 1925 to offer seva of medical care to all sick and diseased who came across. His efforts to make a difference are reflected in his inventions in medication from natural sources as an answer to fighting diseases in common people in an era before hospital and medications were not as commonplace as today. A small step, yet a giant stride. It has now morphed into a caring and gentle conglomerate proudly serving at 7 facilities in India and similar services overseas. Backed by an organization with experience of over 25 years and collective management experience of over 7 decades, Indus Healthcare delivers quality outcome through doctor-managed, personalized and reliable patient care, standing true to its vision, big enough to deliver and small enough to care. Indus Healthcare is now poised to be the most trusted healthcare delivery organizations in country and beyond.
Ek Pita Ek Askiyam Barak. This is a quote from Sikh holy book Guru Granth Sahib. As Guru said, we are sons and daughters of only one Almighty God. So Indus Healthcare, our philosophies revolves around only one point, that is service to humanity. Our mission is to provide comprehensive, competent, cost-effective, environment-friendly medical aid to all.
Indus Healthcare envisioned the need of the future and became the front-runner in deploying the most sophisticated technology in experienced hands to deliver outcomes consistently. Today, it possesses most of the advanced technical innovations in modern medical industry, used as a tool to achieve good clinical outcomes. And it is from good outcomes that our economic wheel spins.
Quality is a simple yet heavyweight 7-letter terminology, which when added to any product or service makes the difference in terms of outcomes. This is our belief at Indus Healthcare. Indus Healthcare, even at this moment, is evolving towards an era of excellence in every dimension, with quality playing a pivotal role. Standardized policies that guide the performance of every procedure, state-of-the-art equipment, calibrated, maintained and checked periodically.
Indus Healthcare is now widening its circle of care and reaching out to newer families with an objective to fill the need for a trustworthy 24/7 specialty healthcare. Our patient-centric facilities are managed hands-on by doctors. They are owned by doctor family, who takes pride in the heritage and family tradition of caring and curing. It is traditional patient-doctor values with just honest, good medicine, being continuously updated and consistently maintaining modernity. For good medicine makes good business, but good business never makes good medicine.
Indus Healthcare Group is committed to provide comprehensive healthcare to the community we serve. We have always strived at Indus to give people the best at the best possible efficiency, and the cost effectiveness has always been our core area where we have focused.
We are different because we do it differently. Indus Healthcare has adopted process innovation approach rather than focusing on product innovation. Our innovation heritage goes back to 1925 when Sardar Jeevan Singh, our guiding soul and family stem, was awarded a patent on his invention of an efficacious wound healing ointment, which he offered on no profit basis to all sick and needy of both undivided and present India. Those values have since endured, and Indus Healthcare, setting up in-house health information technology system and medical pharma logistics units, are few initiatives in this direction. Indus is now poised to set new benchmark in healthcare delivery model in developing nations by its ability to reconcile quality, affordability, scalability, transparency and credibility. The upcoming state-of-the-art 250-bedded hospital at Chandigarh suburb of Derabassi is all set to create higher quality benchmarks in the field of tertiary hospital services in this part of the country. Health and beauty are increasingly merging, and after a person is healthy in mind and body, the natural instinct is to be beautiful. We take it at that sentiment and offer lifestyle medicine to Indus portfolio of medical services. Indus Hygia, a boutique hospital, offers specialty dental, eye care, cosmetic dermatology and cosmetic surgery. Occupational health and safety and employee wellness services. Preventive health checkups, preventive health services, example vaccinations, tobacco control education. Health talks by eminent doctors and health professionals on disease prevention. CSR activities, stress management, ergonomics, diet counseling. On-site occupational health services includes 1. Annual medical examination, 2. Pre-employment medical examination, 3. Exit medical examination, 4. Health assessment, 5. Medical evacuation and first responders services. From a humble beginning of a 50-bedded hospital in 1988, Indus Healthcare has grown leaps and bounds in bed strength, number of specialities, families served, jurisdictions served, etc. At Indus, we own an eager medical management capacity. Even after continuous striving to maintain the trust of families in India, Indus Healthcare is therefore offering its services to address the big deficit in demand and supply of doctor management, honest specialist care in developing nations in Africa and elsewhere. Taking on the company's belief of reaching out to poorly served destinations, Indus set up its operations in southern Africa in the year 2008 with an aim to meet the unmet healthcare needs in that part of the world. Moving steadily, Indus Healthcare currently works in public-private partnership with sovereign jurisdiction in providing specialists clinical services and hospital services management with newer innovative delivery models. Some of the major initiatives out of India: clinical services to Government of Botswana, medical tourism in Kenya, Tanzania, South Africa, Namibia, Lesotho, health IT and medical pharma logistics solution for Government of Lesotho for parastatal aimed at smoothing the procurement, storage, distribution of vital drug and medical consumable supplies nationally. Advanced talks with County Government of Kenya for clinical services and MPL, medical pharma and logistics.
Here we are working in different models. As a public-private partnership model, We are working with the government of Botswana since last 4 years, and we hope to continue. So we hope that we will be able to provide cost-effective care, and Botswana can be hub for the medical tourism in Southern Africa. Apart from this, we want that whatever patients or facilities cannot be provided in Africa, we'll bring those patients to our locality, our facilities in India.
Public-private partnerships in India. Mother and Child Hospital, Fatehgarh Sahib, Punjab, India. Property owned by Government of Province of Punjab on a 50-year renewable lease. This is to be partly built, operated by Indus. Provincial Government of Himachal Pradesh, Himalayan Province, to provide outreach specialist services at remote district hospital in Lahul Spiti in Himalayas. Indus is home to most of the complex medical specialities like medical oncology, nephrology and dialysis, orthopedics, pediatric surgery, ortho and joint replacement, infectious disease department. Indus takes pride in achieving high level of patient satisfaction from across the world.
What I appreciate very highly is the fact that the treatment I got here, the diagnosis which took place was not only on my knee, it was about my body. I think they take the institution as their company, and in that regard, they really take care of the people, so that the people become also part of the institution, part of the hospital.
The treatment that my uncle got here is of high quality, in the sense that I can see improvement on the surgery that he got on his knee. You know, sometimes when a person stays in the hospital, you come across infections and stuff like that. But in his case, there was no infections. It's because of the good care that he got from the doctors and the nurses of this hospital.
Major milestones achieved by Indus Healthcare are employment to over 550 personnel, over 100 doctors qualified in different medical specialities and subspecialties. About 75% of specialist doctors are professors in medical colleges. Indus Superspeciality Hospital becomes an institute of academic excellence to conduct courses on family medicine. Center of Training for Students, Diplomate of National Board, DNB. Over 350 trained nursing, paramedic and ward staff. Organizes structured and practical hospital-based training programs for nurses with various nursing colleges. The mission continues as Indus Healthcare thrives on delivering its unique form of healthcare, with a firm belief that no two individuals are alike. Each one of us deserves a personalized medical attention. Backed by best of technology and minds sourced from across the globe, our aim is to enthuse confidence and health security when you need it the most.